The Center for the Improvement of Human Functioning International presents this luncheon lecture. Today's topic, diet and behavior. What can make your brain a toxic dump? Your presenter, James Jackson, MT, ASCP, Ph.D.
I'm a little impatient because I have a semester lecture to give in 40 minutes or something like this. One thing I'd like to bring your attention to is that we passed lectures that sort of relate to this thing. You can buy these tapes upstairs. Overdosed America by Dr. Don Davis tells you about the fallacy of a lot of pills. The Food Pharmacy one, Dr. Chad gave about diseases and food and how you treat them with food instead of pills. And number 2 is coming up to follow this. Dr. Davis also gave another one on declining food quality and efforts to improve it. And then Dr. Kirby gave one on getting the stress out. Very, very important, because stress really messes up your brain because it causes the blood-brain barrier to sort of open up and let a lot of toxins and stuff go across. And then here's another one by this strange guy, Dr. Jackson. Says, treating various mental and behavioral disorders naturally, the histamine test. We also have a pyro test for that. Books, interest to you upstairs, you may get. This is a good one. Natural treatment of ADD and hyperactivity. This is your child's brain starving? Good book. This one here is about Alexander Schaus in 1980, who first brought the thing of diet, crime, and delinquency, and he was immediately sort of blackballed from every organization in the world. Come to find out that's very true, because Bill Walsh last year did a study on this, and he found out that changing the food in these chronic offenders' biological behavior reduced the behavior 63 to 80% just by changing their diet. Toxic metal syndrome. I'll mention a little bit about this. Dr. Ron's giving a lecture on autism and mercury as a tribute to Bernie Rimland. And this tells a lot about that stuff. This is one of my favorite books, Nutrition and Mental Diseases, Orthomolecular Approach by Carl Pfeiffer. I use this book constantly upstairs. No More Riordan, Treating ADHD Without Drugs, written by a mother who's a physician. Natural Treatments with ADD and Hyperactivity, another good book. And then Lifting Depression, The Chromium Connection. So these things are books that you may be interested in. If you don't want to buy a book, you can go on the web, just type in ADD or ADH or autism, and you get these whole things printed out for you, whole books that are free. That's what I did with this one. And so that's it. I have a question for you. How many nutrients can your body make? Can you make any vitamins? Minerals? 2 essential fatty acids. There's 51 things that your body needs to survive that you cannot make. Cannot make. Then you got to absorb them. You got to take them in, digest them, absorb them, metabolize, and excrete them. God has this wonderful sense of humor. He said, Dr. Jackson, I'm giving you this wonderful body, but there's 53 things you need to live I'm not going to give you. So you got to take them in. There's a nice little article in Newsweek. Anybody see this one about autism? Talk about this. I don't know if there's any relationship. They got Bill and Hillary Clinton at the top, and then they got autism underneath this. But I have 3 copies of this that I picked up free that we can have. I'm also especially glad to be here today because I had a colonoscopy scheduled this morning, and I used this excuse to get out of it. I didn't mean to interrupt your food, but to me that's a big thing. So I don't have. It's only next week I got to do it, but I got out of it today. So I thank you, and my colon thanks you. Now, let's talk about this thing. What does diet do to mental health and mental problems? The simple answer is the ancient Chinese has a saying that most diseases enter the body through the mouth. Makes sense. Most all your infectious diseases like flu and pneumonia and parasites stuff enter through the mouth. And this is related directly to food, things that you don't get in your food that you need, or things that you get in your food that you don't need. Pesticides, chemicals, additives, all this stuff is just in the food. And we're to blame for this, because if you go to buy a piece of steak, you see a nice big round red piece of steak and one next to it sort of gray. Which one are you going to buy? The nice red thing. You know what they do to make these things red? Sulfites and then carbon monoxide. They flood the thing with carbon monoxide, which hooks up to the hemoglobin and makes things red. You know, carbon monoxide will kill you if you get too much of it. So, what is happening to us in the last 20 years or so? Autism increased 10 times. Male birth defects, if you put male birth defects and female birth defects, it goes about 2 to 3.5%. Acute lymphocytic leukemia, 62%. We're supposed to have been, defeating leukemia. You see St. Jude's advertising, all this stuff. We're really beating leukemia, but they've been doing that for 40 years. We're no closer. Treatment is good, but we're no closer to curing it than we were before. It's actually increasing. Childhood brain cancer, 40%. Preterm birth, 23%. Infertility, 5 to 10%. Sperm cells in men are going down. Anybody saw that movie, Children of Men? You see that movie where they're talking about no one can have babies anymore? And so this is what it's all about. Childhood asthma, 2 times. Half of all pregnancies end in miscarriage. And this comes from the CDC, 2000, and these 2 other guys. I'll talk about this article a little bit more. So something's going on, and there's a reason for it. In the U.S., ADHD affects between 4 to 12% of school-age children, about 3.8 million children. This is the reported cases. If you take everybody, ADD, ADHD, and autism, it probably affects 42% of kids and up to adolescents and teenagers. 90% of the world's Ritalin, 90% of the world's Ritalin is sold in the United States. 90% of the Ritalin is sold in the United States. Ritalin is what? Speed. Ritalin is an amphetamine category. So if you take Ritalin, you're taking speed. Recently, they have found out that Ritalin causes liver cancer in rats. Not 10 times the dose that you would take, but only 2 times the dose that you would take. Usually they say, well, this causes liver cancer because they give you 10 times the thing. This is only 2 times the dose that you give kids will cause this. We said this has been a recent thing. I mean, autism has been around for years, correctly diagnosed in 1940, stuff like this. But in the 50s and 60s, it was hard to find kids with these, what Dr. Riordan called the alphabet diseases. That was his favorite term, the alphabet diseases. Put alphabets on everybody. ADD. TH1, one in every school and one in every classroom, you could find one of these. 1 child in every 5 suffers from various disease of behavioral problems, aggressive behavior and all this other stuff. Now, 10 times more boys than girls are diagnosed with ADD. 2 to 3 times more boys than girls are diagnosed with autism. You probably already know that. The boys predominantly have blonde hair and blue eyes, so there's probably a genetic component. Boys also have 2 to 3 times more ADHD than girls. Now, what causes this? All these scientists who write all these journals can't explain these increases. But most of them are now coming to the conclusion that early life exposure to environmental pollutants is a leading suspect. There is a genetic component to this. We know that. There is a toxic component. We know that. If you combine a toxic component with a genetic component, you're going to really have a problem. Depression, we know, runs in the family. Somebody has depression, somebody else is going to have a depression. If both parents have a depression, you're going to have 50% more depression. Now, in the year 2000, National Academy of Sciences stated 3% of all developmental and neurological disorders in U.S. children are caused by toxic chemicals or environmental factors. Now, if you combine that with genetics, and there's about 10,000 genes in the brain, about 25% are due to the combination of environmental factors and genetics. So if you combine a person's predisposition to this stuff, they may have had the predisposition for years, but if they're exposed to these things that we'll talk about a little later, then it throws them over into the problem of these behavioral disorders. Now, they changed all my things in your overhead, so it may not match, so follow along as best you can. 1/3 of ADHD cases in U.S. children may be linked with tobacco smoke, before birth are exposure to lead, mercury, or the toxic metals afterwards, and I'll talk to you about this in a little bit. They did a study on women who smoked cigarettes and women who didn't smoke cigarettes, and I'll show you the data in a minute. This is the brain. Got the cortexes. Different parts of your brain have different things. People with severe autism, where they have these savants, they call them. You know, that people call them idiot savants, but I don't like that term. I call them savants, like musical savants. They are blind. They can play the piano like a concert. All they do is listen to a song once. They can play the song forever. You know, what happens, they think the part of the brain that's not associated with vision goes to this other part of the brain that has the musical part, so that is talent. Same with the mathematical savants. You remember Rain Man, that movie, which I think Bernie Remlin was the medical advisor to that thing, and his son, based on his son, this guy, mathematical savants, they can, take 10 to the 12th power 1,622 by 6,222 and give you an answer like this. But if you say you go to the store, you got $5, you buy something for $1.75, how much change will I have? He'll say $10. See, they can't reason. They can do all this other stuff, but they can't reason. So you got all these brain parts up there. You have the you got three parts of the brain. This is the ancient brain. This is where reptiles, snakes and stuff, they have that. They can't do much. They can eat and fight and run. Then you have the middle brain, like cats and dogs and stuff. They can do something. Then we have the latest brain, which is all this cortex stuff. And depending on what part of the brain is affected, is what happens to you. And this is a neuron. These are dendrites. This is the body. This is the axon. There's about 20,000 of these. These take the messages, give it to the thing, and this gives the messages out. And this is like a little computer. The myelin sheath, that's what coats the brain. This is why fats are so important. Essential fatty acids are so important to the brain. Talk about this in a minute. But this is a myelin sheath. A lot of your degenerative neurological diseases like MS and stuff like this, Lou Gehrig's disease, you'll start losing this coating. As you lose this coating, you can't transmit this impulse. This electrical impulse comes in here, goes here, and then causes the release of neurotransmitters here. And this is made from fatty acids and cholesterol, linoleic acid, which you can't make. You got to take it in. B2, B3, B12, copper, manganese. The B vitamins we call what? The mood vitamins, because they make you feel better when you take B vitamins. If you're depressed, take the B vitamin. Neurons and neurotransmitters. Each of these little neurons here is a microcomputer. You have electrical nerve impulse. Why do we do electrical nerve impulses? They're very quick, very fast, and they can be regenerated. And that's why we have the electrical stuff. That's why you can do the EEG on your brain to see what's going on there. Information, they talk to each other. Neurotransmitters are you talk to each other through these synapses down here. Now, here's something that is of interest about why kids act funny and why we may develop some of these diseases. At birth, the baby has about 2,500 synapses of each neuron in the cortex. By age 2 or 3, there are 15,000 synapses, because this is the age where babies are starting to learn and drive you crazy because of terrible twos and everything. There are 15,000 synapses per neuron. Now, the average adult has about 7,500 neurons. So what happens during adolescence, there is a pruning of these excess synapses, and we think this is a problem in some kids with autism and some of these other diseases because they don't prune enough. And so they have a lot of these things. So if you got a lot of these things, you got more synapses, you got more things going on. So this is pruning takes place during adolescence. This is why some of the adolescents and teenagers act so strange, because they're pruning their brain. At least I like to think that. Nothing to do with our upbringing, of course. Now, let's look at the brain. Brain only weighs about 3 pounds. Only 3 pounds. It's about 2% of the body weight in adults. This is why men's brains are a little larger than women. Doesn't mean they're any smarter. As a matter of fact, my wife went to this, as a nurse, she went to this lecture, says his brain, her brain. She came back and said, I told you so. We're smarter than you. I said, what? She said, yep, the guy said the women are smarter than men. So I said, okay. I don't want to argue with her because I like to eat. So the brain weighs about 3 pounds, 2%, and contains 60% fat. So if somebody calls you a fat head, take it as a compliment. Thank you very much. Thank you very much. 50% is fat. We used to hate to do these things in histology because you cut them and then get all that fat on your blades. You have to clean all your blades. 20% of this is polyunsaturated fatty acids, which is all the double bonds in it. Now the brain is separated by this bony skull, 3 tough membranes, meninges, and floats in a pool of cerebral spinal fluid. Now this is a lot of protection for one of the organs, so it must be important because the body's got all this stuff protected this way. The brain uses, this is another thing to remember, the brain uses about 25% of the total body energy. Only weighs 3 pounds. Uses 25% of the total body energy and 50% of the body's glucose. Your brain only uses glucose for energy, nothing else. So why does China, Mexico, and Spain have siestas? You know, you eat lunch, you go to sleep for 2 hours, right? I think I'm going to start here at the center, Doctor. People tell me they wouldn't know the difference anyhow. But what happens when you digest, all the blood goes to your intestines to help you digest. So you have less oxygen stuff to your brain, so what do? You get sleepy. So these countries know you get sleepy and will be at work, so they give you 2 hours siesta, then you wake up and you're ready to go. See? So we don't have that here. But this is what it is. And, you know, when you don't eat breakfast, you skip lunch, first things that happen? You're getting a little headache, right? Headache, right? Your brain is telling you, hey, I need some glucose here, man. You know, get a headache. So don't skip breakfast, don't skip lunch, because you may wind up like me. Now, I talked about the brain. You don't have this in your handout, but I want to show it to you too. This is a brain. This is a normal brain from a kid, and this is a brain from an autistic kid. Autistic kid brain is about, at the age about 3 to 4 or 5, is about 10% higher or larger than a normal brain. And we think this because they have a lot of those synapses in it, and then it gets bigger, but it's not better, and then about the age 20 it goes. So there is a problem here when autism, when you look at the brain. The brain is 10% bigger than the regular brain. And so there is a biological reason for things going on. Now, here's the thing. Brain cells, there's a little controversy about this now. Brain cells cannot replace itself. One you're born with, you got to keep the rest of your life. It's about 1 billion neurons. There are some people say that you can reproduce synapses in the limbic, the lower part of your brain. But if you could replace brain cells, if you had a stroke, you would recover completely, right? You can't replace those brain cells because if you go to the liver, if you shrunk yourself down this size and went to the liver, saw a liver cell, you say, what do? The liver cell will say, I'm a little liver. I do everything. I detoxify, I make things, I store stuff, I make glucose, I store glucose. You say, what happened to you if this next cell to you died? I say, nothing, because I'm a little liver. You know, it will replace itself. You know, it won't hurt me if he dies. You go to the lung, say, what do? I'm a lung. You know, I take oxygen out, put it on the red cell, CO2 off, make a little enzyme, a little mucus. What happened to you if the cell next to you died? Nothing. Because it will replace itself in 3 days, and we're little lungs. You go to the brain, stop there and say, hey, what do? You say, hey, I ain't got time to talk to you. I got 20 billion, impulses coming here. Get out of here. You say, well, what would happen to you if this cell next to you died? And this guy said, are you kidding? This guy gets 20 million impulses from the olfactory area. If he died, he wouldn't know if he was smelling doo-doo or dandelions, because they can't replace itself. So this is the difference between these things. Now, what makes these things work? These neurotransmitters. It's all these drugs that you get affecting neurotransmitters. About 60 have been discovered, 10 are major, and all these things that we use in your brain come from amino acids, except for acetylcholine. Amino acids are the basis for your neurotransmitters. Now, there's 11 essential amino acids that you cannot make. You have to take them in, digest them, metabolize them, absorb them. And to make an amino acid to a neurotransmitter, you need 17 different nutrients. Nothing works in a vacuum. One thing will make them to amino. You need 17 different nutrients, B vitamins, magnesium, zinc, iron, to convert the amino acids to neurotransmitters. So if you're low on any of these things, there's a standard reason that you're not going to be able to convert these to neurotransmitters. You can have a problem in your brain. Sure it does, right? Nutrition is the key. And you can't make those things I just talked to you about. You can't make zinc. You can't make magnesium. You can't make iron. You can't make most of the vitamin G. You can't make vitamin C. You can't make it. Your body's got to take them in, digest them, absorb them. Now, these neurotransmitters, what happens, these are dendrites. This is the cell body. This is the axon. And this is the impulse coming through there. And down here, this is a synaptic thing. And say, this is a thing for a dendron for serotonin. Okay, you have these serotonin here in these vesicles. This impulse is either excitatory, like acetylcholine, which calls you to do something, or it's inhibitory, like GABA or something like this. So what this does, it actually turns on a neurotransmitter or shuts off a neurotransmitter, like a computer, off on, off on, off on, off on. This is the way it works. So what happens, this impulse comes down, you release the serotonin, it goes across the synapse, and it causes a receptor, and goes down and causes other things. Now, if somebody gives you an SSRI, a selective serotonin reuptake inhibitor, anybody know anybody taking those things? SSRIs? An SSRI, see, this serotonin, if it's not used, it goes back up. It's reuptake. It takes it back in and uses it again. What happens is a selective serotonin reuptake inhibitor will come here and block the reuptake of the serotonin. So you have more serotonin to make you feel good. But after a while, you'll start running out of the serotonin because you're not uptaking it, reuptaking and use it again. So this is why eventually you have to get more drugs, same action. And your monoamine oxidase inhibitors and your enzymes all work in several different ways. But this is how the drug works. Why not give more amino acids and more nutrients and make more dopamine? Things that affect the brain. Stress. Very, very sensitive to stress. Stress, especially in kids, open up the blood-brain barrier and all these toxins go across. Enter through the body through junk foods, snack foods, fast foods, chemically laden processed foods. Now, more than 17 control studies found a diet effect that affects some children's behaviors, sometimes dramatically. I talked about some of these juvenile delinquents. Most of these studies focus on artificial colors, milk, big one. There's about 12 phenol groups in milk. Corn's a bad one, and other common foods. Lack of brain chemical nutrients cause abnormalities or chemical imbalances in the brain. Now, a drug, what it will do, will cure a symptom. It won't cure the underlying problem. So then you give them these drugs for a symptom, then you have to give them another drug because you have another symptom from this drug. So you wind up with another drug. So you wind up with 4 drugs for one symptom. Now, what is junk food? Any food that contains plenty of calories, too much fat, too much sugar, too much starch, too many synthetic chemicals. We are at fault for all this food looking like it is. Because we go to the store, we want something that looks good, smells good, tastes good, right? We demand it. We're going to pass up a little lettuce that's sort of wilted and stuff like this. Remember the last 2 cases of tomatoes and spinach and stuff? What do we have? E. coli. What else do we have? There's another one. Salmonella. Right, salmonella. Food, diseases enter the mouth. Now, synthetic chemicals. Now, junk food has very little of these things that you can't make. Vitamins, minerals, essential fatty acids, fiber, plant chemicals. Now, this is good. Junk food tastes best when taken with a junk beverage. Give me a bag of potato chips and a Pepsi. French fries and a Coke. And I'll talk about that in another minute. This is an interesting fact that will probably scare you to death. You didn't already know it. Research has showed that the average child gets 1/3 of his or her calories from snack food. Teenagers consume more than half their calories of snack food or fast food. A recent USDA study noted that French fries and ketchup are the primary vegetables in most teenagers. This is USDA saying this, not me. USDA is saying this. Critical brain nutrients. We try to overcome. The thing about molecular psychiatry is we look for a nutrition reason why you're having a problem in the brain, not the DSM-4 category where you answer questions, you have this, you have this, you have this, you have this, and it classifies that. We look at reasons why your brain's not working right, nutrient-wise. Critical brain nutrients are overcoming this. They can actually overcome some of these genetic or acquired anomalies and these neurotransmitter things. And what happens with deficient, unbalanced neurotransmitters responsible for many brain-related conditions. You know that depression, bipolar, which would be manic-depressive. In bipolar, men are more manic, and women are more depressive in bipolar thing. Schizophrenia, split mind. Autism, ADHD, and ADD, all related to abnormal neurotransmitters. Examples of brain nutrients are essential fatty acids. We talked about brain is 60% fat. EPA is more important than DHA, omega-3 fatty acids, but you need omega-6s too. Iron, I think this is most under appreciated mineral in the brain is iron. We don't pay much attention to it, but it's very important. Calcium, magnesium. Magnesium is a cofactor in over 300 enzymes in your body. If you did not have magnesium, over 300 of your enzymes would not work. Very important. Zinc, Dr. Riordan used to say that there are 100 enzymes in your brain that need zinc. Very important. Chromium is important. There's a book out about chromium in the brain that helps glucose go across the brain. Selenium is very important as an antioxidant. And then your B vitamins here, the old mood vitamins. Phytochemicals, this is always good. If you can get stuff out of food, it's better for you than take a pill. Because you're going to miss out, and Dr. Ron and other people have talked about these phytochemicals. Broccoli, cabbage, grapes, berries, onions, garlic, green tea, and other herbs. So these things are all very, sometimes it's what gives color, taste, and smell to your food are phytochemicals. Now let's look at what some of the stuff that causes problems. Where did it come from? I wish everybody, if you get a computer, go home and check out this website. There's two websites, Body Burden 1 and Body Burden 2. Now this body burden that we talk about here, defined as contamination by industrial compounds, pollutants, pesticides, additives, etc. None of these things are natural to your body. I mean, they're added. 75,000 chemicals are registered in the U.S. for use. About 7 new chemicals approved each day. Now, this is very important here. This amazed me when I read this. Chemical companies are not required to tell the EPA how their products are used or monitor where their products end up in the environment. U.S. laws does not require chemical companies to conduct basic health or safety testing on their products. 80% of all applications producing new chemical are approved by the EPA with no health or safety data. 80% are approved by the EPA in 3 weeks. Now, the National Institute of Occupational Safety Health provides exposure limits. If you're working in this thing, they'll give you exposure limits for occupational toxins, mainly for people who are working with this, and on the target organs that are sensitive to these chemicals. However, little information is available for the general population about the exposure to these environmental chemicals. People talk about mold in their house. Do you know that there is no standard, no federal government standard for how much mold that you could be exposed to? This is why people lose these suits. You know, when they go to sue somebody for mold in their house, the guy said, what? How do you know it's 2 hours? There's no federal standard for mold. They have not done that yet. I read a lot, and I come across things that are interesting. A recent article identified 201 neurotoxic chemicals, and these guys reviewed the data. They found 278 additional chemicals that are neurotoxic by Neosha. And these are the guys who did this in Lancet. It's a good journal. I published in that one. I know it's a good journal. It's on EPUB. You can get it on the web. No. The above articles listed 4,843 different chemicals that are produced worldwide in volumes exceeding 1 million pounds. Multiply 4,843 by 1 million pounds. And where do we get a lot of our vegetables now due to the NAFTA trade agreement? We get a lot of vegetables from other countries, tomatoes from Mexico and stuff like this. So what do we know they're putting on that stuff? No one expects it when they come in. Don't know what's in them. Now, 20 years ago, about 750 chemicals showed new neurotoxic effects in lab animals. Today, the number is over 1,000. Now, this is where a lot of our problems start. In the months leading up to birth, about the 8th, 9th month, this cord blood here pumps about 300 quarts of blood a day from the placenta to the growing child. Notice I say child, it's embryo, and the womb. This is the lifeline between the mama and the baby, and makes the baby grow and be healthy, supposedly. Now, here's a study that was done on cord blood. 2004, 10 babies, this is 10 babies, in hospitals were tested by different laboratories because they wanted to make sure there wasn't any type of inbuilt bias. They found 287 chemicals representing 8 PFUs used in stain and oil repellents and fast food packaging and textiles. So things you get fapped up in fast food has this PFUs in it. This includes Teflon chemical, PFDA, a carcinogen, been known for carcinogen for years, and this brominated fire retardants and the toxic byproducts. These things you put on your carpet, you put on your furniture to keep stain resistance, keep it from stain resistant. Pants that are stain resistant and wrinkle resistant, all got these chemicals. You're walking on your carpet all the time in your bare feet and you're getting exposed to these things. Now what happens is none of these had 287 chemicals and none of these people worked in a chemical facility. So where are they getting them from? 180 chemicals found cause cancer in humans of these people. 217 are toxic to the brain and nervous system. 208 cause birth defects and abnormal development in animal tests. The chemicals and their source is in this thing here. Go to look on this one, body burden type 2, and it lists all these things. It scares the heck out of you. Did me when I read it. I'm not going to stop eating, but it scared the heck out of me. Now, there's another study by Mount Sinai found that everyone's 91 industrial compounds, pollutants, other chemicals in urine and blood of 9 volunteers. They found 167 chemicals in this group. None of the people worked in the chemicals on the job or in their industrial complex. Of the 167 chemicals found, 94 are toxic to the brain and nervous system. So why are we having these problems with our nervous system and our brain? This is one of the reasons. 79 birth defects and abnormal development, 7 defects affect the reproductive system, males and females. I talked about we were getting less and less children born and more miscarriage and all this other stuff. Behavioral problems, including 1/3 of ADHD children may be linked to tobacco smoke before birth and lead exposure after birth. This was a study. Now this is what will scare you if you smoke or you know somebody smoking. You want to tell them about this. Study done on 4,000 U.S. children between ages 4 and 15. Children whose mothers smoke, well, we know alcohol causes alcohol fetal syndrome, right? When they drink a lot of alcohol, the baby's born retarded and all the other problems. Smoke is just as bad. I don't understand why they don't, they outlaw cigarettes, but they don't say anything about alcohol. Alcohol causes more death each year than cigarettes do. So, mother who smoked during pregnancy were 2.5 times more likely to have ADHD children than mothers who did not smoke. My question here, why didn't you check for second-hand smoke? Children with blood lead levels of more than 2 micrograms per deciliter were 4 times more likely to have ADHD than those with level less than 0.8 micrograms. Now, this is what scares the heck out of you. The government's acceptable level for blood lead is 10 micrograms per deciliter. Why? Lead serves no purpose in your body. Why have they got 10 micrograms? Why isn't it 0? Why isn't it 0? It has no purpose in your body. It's a known toxin. Why don't they say blood level is 0? Anything above that, you need to be treated with chelation or something. It serves no purpose in your body. Over 5 million kids, 4 to 15 years of age, have more than 2 micrograms of lead in their blood. And we know that if you test kids with high levels of blood, their IQ goes like this. I mean, it's almost a straight curve. Blood lead levels, IQ goes down. I mean, we've proven that here at the center. Food additives. Notice the food you ate today did not have any additives in it because we are organic. We have an organic garden out. We get all our stuff. We get organic food. So you're not going to go wacko or hurt somebody or, when you leave here because this is all organic. You can't sue me either because this is all organic. That's what I like about this place. All the food we have is organic. We practice what we preach. Now, food additives. Why do we have food additives? They serve no purpose in your body. They're added to the food. That's why we call them additives. It's not rocket science stuff. Food additives. What do? They make food look good taste good, smell good, and last longer. We are to blame. We are to blame. We're not going to buy that wilted lettuce, for God's sakes. We're not going to buy that little gray-looking piece of meat. We're going to get that big red thing and that big crispy lettuce and get those 6,000 different chemicals. About 75% of the food we eat undergoes some form of chemical change. We eat 1 million pounds a year of approved food additives. The average American eats 14 pounds of additives and 8 pounds of salt per year. My wife said this has got to be a misprint because I do this every weekend. So there's 10,000 food chemicals. And now, Dr. Feingold, anybody heard of Dr. Feingold? Really great guy, yeah. 1967, he first reported that for every girl sensitive to additives, 9 boys were found to be sensitive. This almost mirrored the proportion of boys to girls reported to be delinquent in the United States. And he was immediately castigated by everybody in the world about, especially the drug companies, about there's nothing related between food and behavior. But he proved they were wrong. This is what scares me with kids and the snack foods and stuff. Studies shown the average daily intake of food dyes in a child, and food dyes really mess up your neurotransmitters in your brain. Sometimes they'll act like SSRIs. They will block the neurotransmitters, or they cause the production of the excitatory neurotransmitters. This is why these kids are always active and hyperactive. The average food is 75 milligrams a day. 10% again, 150. That's 24 pounds a year. 300 milligrams a day. That's a lot. One dye, this one, red dye number 3, inhibited uptake of dopamine in rat brain tissue by the NIH through this study. Now, if you inhibit the uptake of dopamine, which is a calming and get you going enzyme, you're going to have problems. Behavioral disorders or minimal brain function. NIH admitted that there's enough dye present in soft drinks, licorice, and candies to produce such an effect. This yellow dye number 5 is a very bad one. This is one Dr. Feingold identified. Sensitivity was first reported in 1940. And you know what dyes are made from? Food dyes are made from coal tar. Coal tar, a petroleum product. They take petroleum and they'll boil it down to get a tar, and then make all these food colors for it. Coal tar, if you rub it on an animal long enough, you'll cause cancer. You know, we did this experiment a long time ago. Additives, colors, and flavors. So it's hyperactivity, poor sleep patterns, behavior, learning problems, irritability, and ADD. This is documented, but every time you come up with this, a drug company comes up with another study says it's a bunch of bovine scatology, which is a fancy word for bull poop. Somebody asked me what I think, I said bovine scatology, whale scatology, you know, dog scatology. I don't know what I'm talking about, but I'm telling them animal poop. 2 antioxidants identified Feingold as damaging are BHT and BHA. You can still find this. Pick up a package in the store and look on the side of ingredients. I guarantee you, you're going to find these 2 listed, BHA. They're antioxidants. They're phenols. Phenols are things that are on toluene or alcohol stuff, and they've got a little group. They're very fat soluble. They protect animals, produce these things to keep insects and diseases from attacking them. People say, well, these plants are great. They make all this vitamin C for us. They're not making any vitamins for us. They're doing them for themselves, to protect themselves. We're just eating them because we're eating the fruit. They're making them for themselves, not making them for us, because they serve a purpose in the plants. So both have been caused cancer in animals. California has recently declared these as carcinogens, and this is what they are. Butylated hydroxyanisole, or BHT, is butylated hydroxytoluene. Toluene is stuff they put in fingernail polish remover, you know, for God's sakes. And these are fat soluble, and they're phenols. They preserve fats in foods. Anything that's fat soluble, they stay for a long time. You know, a water soluble thing doesn't stay around too long, like vitamin C. But a fat soluble, A, D, E, K vitamins stay around for a long time because they go inside the fat and stay there for a long time. So these stay for a long time. Now this other one here, TBHQ, tert-butyryl hydroxyquinone, is also a phenol. Fat soluble substance in blood for a long time. Now these things that you take, these are toxic chemicals, and you look on every package and they're in there because they make the food look good, smell good, taste good. Also destroying your brain. Food allergy and brain function. One of the big things we found here, and I was surprised when I first came to work here 20 years ago. I was usually a traditional trained guy, didn't believe in this stuff, until I started seeing it. Food allergies is brain function. All organs work together. One is energy disturbed and they affect other organs. And cells of the immune system, this is what's important. Cells of the immune system have receptors for and can produce some of the same neurotransmitters found in the brain. Now, the GI tract, this is why food allergies and leaky gut syndrome, wheat, milk, casein, all this, tremendous effect of the brain and immune system. The brain and the immune system and the gut are all interrelated. More than half of all the immune cells that you have are located in and around the GI tract. So anytime something affects the GI tract, it's indirectly going to affect the brain. Now the brain has, besides these neurons, they have what's called glial cells in them. The neurons do not cause primary brain cancer. It's the glial cells that give structure and form to the brain and that myelin sheath that cause primary brain cancer. It's like a shell of an egg. That's what causes the shape of an egg. The same thing with these glia cells, means glue. Glia means glue. These glue cells give the shape to the brain. Also, they got two of them in there that are immunofunction brains that keep your brain, because the blood-brain barrier, they got these glia cells that protect the brain. More than half all the immune cells located in the gut. Leaky gut syndrome. The gut mucosa cells, the leaky gut syndrome, only one cell thick, and they live only about 3 or 4 days. So they come and go, they come and go, come and go. They're lined together with no space between them. We have a leaky gut followed critical illness, trauma, stress. Now, stress can really mess up the brain. Constant stress will really mess up your brain, because you use your vitamin C, will go like this. Vitamin C is used in the adrenal gland to make epinephrine and norepinephrine from dopamine. So the more stress you're under, the more epinephrine and norepinephrine you make, the more vitamin C you use, so the vitamin C goes like this. You can't make it, so if you're using it up, the first 2 symptoms of vitamin C deficiency is you're irritable and fatigued, tired and cranky. My wife threatens to give me IVC every time I go home. Said, you have a vitamin C deficiency today, don't you, dear? No, it's my normal self. Tired and cranky. So leaky gut followed critical illness, stress. Stress also will cause this leaky gut syndrome, also causes your blood-brain barrier to open up, and all these stuff. And burns, major surgery, antibiotic or anti-inflammatory drugs, excessive eating of dry fried foods, starchy foods, or sugary foods, food allergies, leaky gut syndrome. I said I'm giving you a semester lecture here in 40 minutes. Now this is what we talk about leaky gut. This is your mucus layer. Now you notice it's got all those little pilly things here. If you take your intestine, the absorption surface of your small intestine and your large intestine, if you spread out, it's the size of a tennis court, because you got all these microvilli in there. It makes your absorption surface. So your absorption surface in your intestine is the size of a tennis court. You can actually get that much because of these villi. But these cells are only one cell thick. They're replaced very quickly, and they're really tight chunks. And so all these bacteria, food antigens can't go across. Leaky gut syndrome. Well, these junctions open up, leaky junk. We have these damaged microvilli, these tight junctions, so we get bad bacteria, we get food antigens coming across, and as long as this stuff is staying here, the body doesn't recognize it. Yeast will cause this too. But as soon as this stuff gets across here, you start producing antibodies against these antigens, and you have all kinds of problems. I want to show you an example of a food sensitivity test we do here. We do 90, then we can do another 90, and we do 25. Now what we do is take a person's blood and react against purified antigen. And 0 is okay, and then you have different. Look at this patient. 3 plus, 3 plus, 2 plus, 3 plus, 3 plus, 3 plus, 3 plus, 3 plus, 3 plus 4. This person, look at this aspirin. Aspirin is a salicylate. There's a lot of foods that have salicylate in them. So if you're aspirin sensitive, acetylsalicylic acid, there's a lot of foods that have this in that are going to make you feel bad. And there's a list you can get off the web about all the salicylate foods. So this guy should be careful what the foods he eat. You should never take any aspirin. He also has a lot of sensitivity to what called the nightshade plants. One of this guy's symptoms was he had a lot of pain, joint muscle pain, had flank pain, and all this other stuff. What do we know about nightshade plants? Tomatoes, potatoes, eggplants, green peppers, stuff like that. They're notorious for exacerbating joint muscle pain. They found this out many years ago. These farmers were growing potatoes and tomatoes, and they was feeding their cattle the tops of the plants, trying to save some money. After a month on these, the cattle's neck got so stiff they couldn't bend over to eat. They had to drop to their knees to eat. So they called this guy in Cornell. He says, "What are you feeding them?" He said, "My God, those are nightshade plants. Take them off that stuff." Took them off that stuff. 6 weeks later, fibrosis were gone. They were eating fine. So they do exacerbate these things, nightshade plants. So this guy has a lot of problems now. He's going to have to, and this also causes, at the back of your thing, you'll see some case histories that we wrote apart. There's a 17-year-old kid in the back that we talked about. They were about to admit this kid to a mental institution because he would get so violent, tear up his house, his parents had to call the police to come home for their 17-year-old kid. And to come to find out, he came here, his mother came here to Dr. Riordan, she said, "You are my last resort, they're going to committee." One of the first things Dr. Riordan did was did a food sensitivity, and his food sensitivity looked like this. Looked like this. And this guy was taking antipsychotic drugs and made him worse. So Dr. Riordan took him off most all these foods. Dr. Ron said he found out the guy had a little hypothyroid, gave him some thyroid. You know, within 6 months, the guy was back in school. Remember this guy, Dr. Ron? Yeah. About 8 months, 10 months, he had a job. Graduated from high school. Married. Family. All because he had food sensitivities. Affect the brain. 20% of all schizophrenias are called cerebral allergies because you have these things. Remember we talked about immune cells, gastric, brain, they're all associated. If you take them off this thing, we see a lot of kids. We do this on a lot of kids, you know, come in here and, you know, just tomatoes, green peppers, a lot of things, this guy. So we take them off these things, you know, and I'm amazed at their response. Now, this is a type 1 and type 3. Most of the things, if you're allergic to peanuts, you know you're allergic to peanuts because you almost die when you eat them, right? Type 1 hypersensitivity, anaphylaxis. This is more of a type 3, which is delayed hypersensitivity. It may take you 2 weeks for these things to show up. So it's hard to diagnose what you're allergic to. So this is a type 3 type. But if you take them off that stuff, and the restriction diet or taking the food away from you is the best way to test if you've got food allergy. If you think something's causing you problems, stop eating it for 7 to 10 days, 2 weeks, and then put it back in your diet and see what happens to you. Best way to do it. Skin tests are only 20% accurate, what you're allergic to, and it's only type 1 hypersensitivity. But this is a perfect thing because we take your own blood and measure against all these antigens. And we look at it in the microscope. We are the only few people in the United States to do these tests. Natural foods talked about in an intelligent way. Junk foods are illiterate, cannot direct missing. Casein from milk or gluten from wheat are not properly digested. These things form peptides just like morphines. We call these exorphins. You know, endorphins are things that your body's on morphine if you get hurt real bad. You know, I used to be in the military. I see these guys, you know, hurt real bad. They say, "Oh, don't bother me. I'll go and get the other guy. I'm fine." You know, leg hanging off and go back there. 15 minutes later, he's screaming for you, "Come back over here, come back over here." So you got these endorphins that are like your body's morphine. They protect you for a while. These exorphins are the same thing. They protect you like morphine, like peptides. Now, kids get addicted to these foods, and one of the problems we have when we take them off all these things here, they'll say, "God, I feel worse." You know, first 2 weeks you feel worse. Why do you feel worse? You're detoxifying and you're withdrawing. You're getting all this stuff out of your system. Sure, you're going to feel worse. We say, hang in there. And then the next complaint is they lose weight. Remember that? Lose weight. So what are you complaining about? You're losing weight, for God's sakes. And the first question I ask somebody when we do food allergies, what foods do you really like? What can't you do without? You know, because I know right then that's a clue that they're allergic to. Because you crave the things that you really like because you're addicted to them almost. Or I'll say what foods you really hate. That's another clue that you're addicted to these. Now, according to Dr. Pfeiffer, which is that little book I showed you that I think is a great book, 20% of schizophrenia are caused by cerebral allergies. Now, some symptoms of the food allergies that you can find out if you got it or not is that you eat stuff and after a while you get dizzy, you get irritable. Our kids are aggressive, they're hyperactive, agitation or anxiety, poor concentration, mental exhaustion, insomnia, migraine headaches. And those case histories attached I got there. And these case histories, that's only a page or two of them. They're all down in the library. These are all related to food allergies, food sensitivities, or things that are added to your food you don't need. Now, how are you going to diagnose and treat these patients? Well, Dr. Ron gave a talk. What? If you really want to find, if you've never been helped by people and you go get pills after pills after pills after pills to treat a symptom and not to cure the disease, our pledge here is we want to cure the disease, not treat a pill for a symptom for a pill. Have nutrients measured in your blood, urine, and hair, which we do. If you're lucky enough to have hair, you can have it done in your hair. But hair is an excretory organ. It tells us what your nutrient stat, your mineral status has been for the last 3 months. Red blood cells, last 3 months. So we do red blood cell minerals. We see what your mineral status has been the last 3 months. Serum is only about 12, 14 hours. Urine tells you if you're excreting stuff or not. So we do all these things. We show heavy metals, mercury, lead, cadmium, aluminum. I'm not going to talk too much about mercury. Dr. Ron's giving a good talk about mercury and vaccines. Everybody heard about mercury and vaccines causing autism? Raise your hand. Let me see. How many people believe that? Do you know for years that the EPA, the FDA, and the American Pediatric Association and the vaccine drug makers say it doesn't? You know what they did in 1999? Even though they said it doesn't cause any problems, they took thimerosal out of the vaccines. But to replace it with aluminum. The aluminum. The EPA recommended dose for aluminum is 25 micrograms per liter. One shot of one of the pediatric vaccines has 800 micrograms of aluminum. If you take all 3 doses of those vaccines, you get 1,600 micrograms of aluminum. 25 micrograms is the EPA level. Dr. Lawton brought that up. Remember that? Dr. Lawton's a physician here. He had a new baby. He wasn't going to give him, mercury stuff. Then he found out, God, mercury's not as bad as aluminum now. But they give aluminum in there to protect it. And aluminum, as long as your kidneys are working fine, you can get rid of it. But we know aluminum causes dementia because when we first started doing dialysis, we used aluminum cans to heat up the thing. And after a while, people were dying. They said they're dying of infection, But the guys started looking at their brain. They all had all these plaques in their brains. And they would go crazy or go dementia before they died. They call it dialysis dementia. You know what was causing it? Aluminum. Because they had no kidneys, they couldn't get rid of it, built up in the brain. Now, change your diet to whole foods or live foods. Live foods are foods that contain enzymes. That's what we call them, live foods. And this is my last 2 words that I'll leave here. Is that remember, depression is not a Prozac deficiency, nor is ADD or ADHD or Riordan deficiency. Thank you very much for coming. Any questions? Quick.
We will take a couple of questions. If you would, please wait for the microphone, and we will come to you.
And make it easy. I'm tired.
The veggie wash that they sell in the stores, does that do any good whatsoever?
The what?
The veggie wash,
You know the name of it? Yeah, it does because it removes some of the external stuff on the thing. This is why it's easier to peel stuff. If you got something you can peel it and get rid of it. And eat it like an apple or stuff like this or a carrot. Because most of the things that are contaminants are on the outside, not on the inside. Another question. Oh, God. She used to be my student in 1994.
Okay. What if you're a woman and you wanted to have the hair test, but your hair is chemically treated?
Not you, of course.
Not me, of
Somebody
course,
else.
but right.
We take and do it with nitric acid. We take and digest it with nitric acid. When nitric acid removes most all that interfering stuff. You used to be careful of dyes and stuff like this, but not anymore. Another question?
Do we have any more questions? Those that are in the overflow room, if you'd like to ask a question, please come into the panorama room.
I'm sorry I covered so much information, but if you come back for Dr. Chad's lecture, Dr. Honeyhockey's lecture, Dr. Kirby's lecture, they're going to pick up on some of the stuff that I didn't talk like about mercury and stuff like this. Mercury has no purpose in your body. None of this stuff has no purpose in your body. If it's there, it's a contaminant and it's causing problems. Yes, ma'am.
What do you think of the use of enzymes, taking enzymes, since so many enzymes are cooked off when we cook our food?
I said, well, say a lot of food contains enzymes, right? So if you get an organic food, you don't have to worry about that. But you can't, certain enzymes that are in the plants are not exactly in your body. They're different enzymes. But some of them are the same. But I take enzymes myself because I've had a yeast problem in the thing, and I get a lot of gas and bloating, and then I get uglier, so I go and take some digestive enzyme. But as you get older, you start losing stomach acid, so you have digestive problems. You start losing enzymes, you have digestive problems. It comes with the 30-year-old body I have here. Times 2. That it? Thank you very much for coming. Appreciate it.
The preceding program was presented by the Center for the Improvement of Human Functioning International in the Bright Spot for Health Lunch and Lecture Series. To inquire about additional health-related information available on DVD, audio CD, VHS, or audio cassette, simply call 316-682-3100 or drop by 3100 North Hillside in Wichita, Kansas. To discover more about the center and what we have to offer, be sure and visit us on the web at www.brightspot.org.